Post-holiday sickness is spiking. For some, it's a few days in bed, but some hospital ERs are overloaded. Action News Now reporter Taylor Helms shows us how Mercy Medical Center in Reading is coping with the surge in patients.
We got our hands on an email sent to staff at Mercy Medical Center in Reading. It shows an overload of patients and a lack of staff to meet the demand. That email reads in part, "The ask is for assistance to cover patient care for admitted patients and offer support to all units." The email says the patients waiting to be admitted in the emergency department are waiting more than 20 hours to be seen, and dozens more are waiting in the lobby. I reached out to the manager of media relations at Mercy Medical, Allison Hendrickson, to see what the staffing situation was like, as well as how many patients the hospital is seeing right now for flu and RSV cases. She says in the month of November, more than 200 children and adults tested positive for RSV. Hendrickson adds not all of them were admitted into the hospital. As for the staffing shortage, Mercy Medical confirms a significant increase in respiratory patients and staffing shortages. The hospital is also urging you to wash your hands frequently, wear a mask, and socially distance when appropriate to help slow the spread of RSV. Reporting in Reading, I'm Taylor Helms. Action News Now, coverage you can count on.
We checked with Enloe Medical Center. They say flu and COVID cases are up in Butte County, but there's no overload at the hospital. They're coping with a higher number of sick calls, though, among staff. So how do you know if you have the cold, RSV, or COVID-19? Well, body aches, those are common whenever you have the flu. When it comes to a cough, you're going to see that common in all three different illnesses. Fever, sometimes with RSV, but more common for COVID-19 or the flu. And when it comes to difficulty breathing, it's really COVID-19 where you're sometimes going to see that as well as RSV, but that's rarely an issue when it comes to the flu.